A year on and still the nation's only permanent drug testing service. The milestone's been marked with the release of a report on CanTEST's effectiveness.
Really, the service is demonstrating that it's doing exactly what it was set up to do. It's giving people good information about what's in the substance that they were already intending to take. It's giving them good information about how to reduce the harm associated with taking that substance.
The review found that in its first 6 months, about 1 in 10 tests resulted in the owner discarding the drugs after learning about their true contents. And about half the drugs tested didn't contain the substance the owner thought they would, a few raising serious safety concerns.
Earlier this year, the service issued its first public health alert after chemists detected a potent and potentially deadly synthetic opioid in pills falsely sold as oxycodone.
The government feels that's worth the $1.2 million cost of extending the trial to the end of next year.
That's obviously, when you put that into the context of potentially saving admissions through the emergency department and into hospital, you can see the cost effectiveness of that prevention element of the service.
The review found 70% of those who accessed the site in its first 6 months identified as male. Almost 40% were aged 24 or younger. 70% said they'd never previously accessed information about drug use in a healthcare setting. Laws that decriminalise drug possession in small amounts are due to come into effect in October, which may extend CanTEST's reach.
Particularly for people who inject drugs, there's a long-standing stigma and fear of coming into health facilities for fear of being targeted by police. And so we're really hoping that the change in legislation will lead to more people feeling comfortable to enter facilities such as One More Street to access drug checking.
Hoping to reduce risks for some of Canberra's most vulnerable. Georgia Roberts, ABC News, Canberra.